Good morning, everybody. Thank you so much for joining us for the Incarceration Prevention and Reduction Task Force and Law and Justice Council meeting for September 22nd, 2025. I'm Peter Frazier. I am co-chair of the IPRTF along with Heather Flaherty, who I hope is on the call and in the meeting. Thanks again for joining us. We've got a big agenda today. So we're going to want to move things along as best as we can and getting into all the important details. We do have, we send out an invitation to folks in the Whatcom County and the cities, various cities, courts and legal and justice system for a discussion we're going to have about our prosecutorial diversion legal model. And so they'll be joining us here today. I'm going to start with the land acknowledgement. And Jill, would you roll that up on the screen? Thank you. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Sanish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. All right. Heather, I'm not seeing your name up there, but please jump in at any time. I'll just kick things off. And do we have a quorum yet, Jill?
I'm still tallying. I'll let you know.
Okay. I think what we're going to do, Bertie, is we're going to move you down the agenda. And as soon as we have a quorum, we're going to put you in line for that. So Hannah, if Hannah Fisk is up next from Health Department, and she will be, it does say here that she is talking about the 23-hour crisis relief center, but really it's more than that. And I'll give a little bit of a backgrounder on where we are. A while ago, many months ago actually, we determined that for our schedule, for planning and designing and building our new jail and behavioral care center, we'd better get our prosecutorial diversion model, our behavioral care model together and figure it out by right around this time so that we did not halt any sort of planning. So we did put together in this group, the IPRTF, a work group made up of the prosecutor's office, the public defender's office, health department. We had members of the corrections, sheriff's department. We had a member of the court as well, all together in the same room over about 5 meetings to look at best practices, look at the Nashville model that inspired us in the first place for a behavioral care center. And I'm very proud of the work that this group did in this work group to come up with a what we're going to be looking at today. Hannah has done an incredible job in pulling all the pieces together, and we're going to get about a half-hour presentation from Hannah around this work, and then we're going to have a discussion Yes, Jill.
We do have a quorum.
Fantastic. Okay, after we're done with this, then we will we'll address Bertie's agenda item. Thank you for that. So with that, oh, and then we have a recommendation. This group, this work group did its work as it should have. It completed all of it and then decided to sunset the group. And we made a recommendation to the IPR and also to the FAB group, the Facilities and Finance Advisory Board. So that's what we're doing here today. And Hannah, do you want to take it away?
Yeah.
Oh, and also hold all questions, if you would, for Hannah to make her presentation, and then we'll get to the questions.
Thanks, Peter. I'm going to share my screen. Can everybody see that okay?
Yes.
Okay, great. Some of you are going to see this so many times, I think at this point you'll be able to present with me. So thanks for attending again. This is an update just kind of on our justice implementation and new jail build from the lens of behavioral health. These are concepts, visioning, ideas, all of the work that's been going on to kind of create things that we can present to the design build team and information that we've gathered that helps inform decision making that's going to be coming up. So this is to kind of get us all on the same page, but also know that these are just the concepts being discussed and no decisions have been made. And so these presentations have been really helpful, hearing everybody's perspectives, gaps that maybe haven't been identified, or things that people really like and hope that we move forward with. So thank you all for listening. I'm first going to start, there's three main sections of this presentation: behavioral health in the jail, behavioral health in a behavioral care center, and then the 23-hour crisis center, all of which are part of our justice implementation plan. So this all starts with our implementation plan, talking about long-term goals, outlines it. This is kind of where we've started and what's been built upon, and so we use it as our foundation. When we talk about the jail and behavioral health, we talk about it starts at booking. So as soon as someone is institutionalized, we know that trauma occurs, that changes to the person happen. And so what we really want is at booking for there to be reentry staff, people there helping them make phone calls to caregivers, loved ones, maybe mental health staff, substance use disorder professionals, whoever is appropriate, but that in the designing of that booking, that those staff can be there and help them get out as soon as possible. So when you see in this image, I use images throughout the presentation just to kind of show elements that we're talking about. These are not done by our design team. We'll get those illustrations when we get there, but I do have photo credit like on every image, so you can look at those design teams and see what kind of work they've been doing. Here you see natural light, you see phone calls that are free that you can make as often as you want in an open space to be. So we're looking for that kind of idea at booking. Again, this is a place where we hope people will not further into the jail, that they can exit back out from here. When we talk about people who've actually moved into the housing pods or the units, so the booking, we were not able to get them out. What we're talking about here are elements that seem to be important. So natural light. If you look in the back here, this is actually a rec space. So access to a rec space throughout the day as needed, where there's light and air, fresh air, murals with designs, landscapes, long distance looking. An area that has color and texture. You can see on the floor that there's different ways of using texture for rugs or things that make it feel more welcoming. Most importantly, or more importantly, what we're looking for is treatment that's accessible in those units as well. So we want group rooms, we want individual rooms, we want spaces where you can do anger management, parenting classes, SUD work, anything along those lines. We have like Welcome to Suit Resolution Center wants to come in, right, and do groups that they've always done, or DVSAS. And so we have so many great partners, but we need space for them to be able to access the people who could benefit from those services. Some of the other elements too are that in each unit, possibly having individual visiting booths within those units so the people don't have to be cuffed and transported down, which is always dependent upon correction staffing, that they can actually go to their visiting booth from their unit and somebody can access that space. One thing that we're really missing is a really as comfortable as it can be space for children to visit their parents or loved ones. And so designing a visiting booth that allows color and textures and games to be played. And if it's not safe to have touch, then there's still a barrier, but also considering a room where you can have contact for children with their family. And again, it doesn't feel so gray or concrete. So those are all things that we've talked about. There's also designing medical spaces to be in these units as well. When we look at images of these facilities, this is kind of more illustrations of the same. So this is a new build of kind of a traditional style. It's kind of in a pizza shape, and then up top, you kind of have a spaceship feeling vibe where people look down from an observation unit into it, or they're behind a screen. And so when we talk about elements that seem important, one of them is direct supervision. And if anybody has more questions about that, I'm so glad Chief Erickson is here on the call to answer that. From a behavioral health lens, what we're looking for is in these other spaces, one, you get more color and texture, but when you have direct supervision, it means that a corrections officer is on the floor. And when we think about subtle symptoms or changes in someone's behaviors that maybe we could address before escalation occurs, or could maybe see signs earlier of decompensation. That human contact allows us to see people and empathize. And so we are, in support of getting more people into the housing unit and having regular contact. One other element that we're looking at is, and this was shared widely in Crossroads, glad Marty, Holly, one of you were here, that they did a kind of a focus group and information gathering from our current inmates, and it showed that people really were asking for more space for some higher level symptoms of behavioral health illness. And so when you look at housing units that are specific to behavioral health needs, maybe people whose symptoms put them at risk to themselves or others, maybe they need a different level of support or a different type of housing. And so smaller staff to inmate ratio, more soundproofing, because maybe the external stimuli creates a lot of stress and escalates them. So if you see in this image, while it doesn't have all of the elements we're looking for, there's kind of two layers. So often what happens with people who have more acute symptoms, they end up being isolated. And we know that that further deteriorates a lot of their wellness. And so in systems like this, you have kind of separated areas. So you have some cells, but maybe there's a shared space with only 4 people. So they can come in and out, and then there's another layer outside of that. So it really helps reduce stimuli, it helps reduce sound, and in these units, there's typically more programming. So more of an inpatient or intensive outpatient model built in. So it's a lot of more day programming and treatment accessible for people who need more support in their stability and recovery. We're also looking at an acute medical unit. And so this would people from, not a medical perspective, from a behavioral, have high acute psychosis, or maybe they're actively suicidal right now. And so they need line of sight 24-hour supervision. And so this would be a place to hopefully stabilize, get out of that crisis situation and back to general population or maybe a behavioral health unit. These also come with things like zero pressure rooms, or we're talking about detox beds specifically, so they have a higher level of monitoring when they have medical concerns that warrant that. Caleb, I'm sure, can speak more to those, but this is kind of the next step above that behavioral health unit. And then when you exit the unit, exit jail, what we're hoping for is what's called a rapid resource center. And that's a unit that's technically out of custody, but at exit, you go through this, or it's kind of really hard not to go through it. But a space that's warm, it's welcoming. Hopefully it has all of the people that were there at booking, that were there in your housing unit, providing those anchor management classes or support to you. We're talking about partnerships when you enter back into the community, and they're all here at exit, helping you charge your phone, get clothes or snacks, helping you to figure out, who wants to, who can come pick you up or give you transportation to the next location. Again, this is not in corrections. So then we move on to our behavioral care center model. And this was the idea was taken from the Nashville model, which is an in-custody prosecutorial diversion program. It's inpatient. And so that's where we started and kind of where our learning went. Some things that came out of this were, one, it was a new facility to be built. And the questions were, are we going to do in custody like they did, or do we want to go out of custody? If we go out of custody, do you want it to be on site or do you want it to be off site with the jail? With those big questions, what we knew is that we wanted to reduce unnecessary incarceration. We want people to get out of jail or not go to jail as much as we can in our community. This could be pre-filing deferral, it could be post-charging diversions, pre-conviction in that realm. We wanted to maximize as many eligible cases as possible and maximize funding stream because inpatient models can be quite expensive. You'll see here that we also, in this process, Eric Ritchie and his team with Eric Sigmar have been very much a part of this process and really early on said in a letter that they support a prosecutorial diversion program and we're very willing partners to figure out how to make that happen. So when we go to the in custody versus out of custody, here's some pros and cons that we found is that when it's in custody, it's a pretty straight legal pathway for people with charges and who are not eligible for release. So how this looks is you're in jail and between the prosecutor and your attorney, they've agreed that you're eligible for this inpatient treatment prosecutorial diversion program, and you're in jail and you can walk down the hallway and enter a different unit, but it's still in custody and you engage in treatment. In these units, the corrections officers are often in scrubs, but there's that higher level of safety for the people who are staffed there and for the people receiving care. Typically, what we found is that there is a higher level of completion for people who go to that type of treatment. And again, it's a contained environment. What we've learned is that the Nashville model that this is looked after has about 18-day average stay. So when you think about treatment in an inpatient unit, that's about as much as you could get, roughly. We seem to have maybe 17 to 27-day average that we look at. And so if we were on the 27-day, that's kind of, that's where I would go is what can you do within 27 days? In an in-custody model, kind of the cons is that it's not flexible. So even if somebody has medical necessity to stay, let's say 20 days, if on day 15, they can be released or have to be released, they have to be released. You can't keep somebody in jail just because they want treatment. So it kind of is less flexible in that way. The other big thing that we came across in a Medicaid feasibility study done by HX.
Human experience.
Thanks. Human experience is that there's no Medicaid reimbursable dollars, so to speak. There's a few through the waiver if we are able to get that in place, but it's mostly all uncovered. And, we're looking at a range of maybe $3 to $5 million annually if we operated it today. So in a few years, obviously that changes. It's also technically still in custody. So if I bail out and I'm released, but still judicially involved, I couldn't self-select to go back to jail for treatment. So again, it kind of limits that scope. And then the long-term longitudinal studies, well, that's still kind of limited, show that maybe there's more drop-off later on because there's not as much reintegration because you're either in custody or you're out of custody. So when we went out of custody, what we found is that you're Medicaid eligible, actually, any insurance plan that would pay for the service, will pay for it. We've been told it feels more voluntary, more recovery focused because it's based in the community. You can offer different types of treatment. So for example, like Alexis is here from the Low Intensity Men's Residential Treatment Center, and that's a 3.1 level of care. So in some places that could be an option or a a more intensive inpatient model. So you have more flexibility to decide kind of what do we want in our community. There is a legal pathway for those who are released. So if I was in jail, I got bailed out, and then this was offered, and I said, okay, yeah, I want to do this. I can choose to, with the prosecutor and my attorney on board, I can choose to go to this treatment and use it as a prosecutorial diversion. And then there's also longer treatment. So it's not dependent upon my custody status. So if medically necessary, I needed 40 days, I would be able to do that as long as we set the program up that way. It does require much more legal coordination. It would require a lot of community effort and follow through and a shared vision. What they also found is completion rates typically aren't as high because you can walk out, but longitudinally, it seems to be more successful. So when we look at this in a map with the intercepts up at the top, we have 0 being there's no interaction with law enforcement yet, and 5 being we've gone through the whole process and we have been in jail and released. The green is the in custody model. So you have to be charged because you can't stay in jail if you're not charged with something. So it has to be kind of in this area here. But an out of custody can be intercept a little bit sooner. In fact, the out of custody model could be anywhere because you don't have to be judicially involved to access an inpatient treatment unit. But for the sake of prosecutorial diversion, it could fall a little bit closer for in the intercept model. Okay, so if we went with the theory that we were going with the out of custody model, then the next question would be, is it on site with the jail or is it off site? And so then we kind of ran into another stumbling block of what do we do here? So if it's on site with the jail, a really big benefit is that if I'm in jail and this offer was given and I choose it, I could walk out one door and walk in another door. No transportation needed, right? It's on the same campus. So less likely for elopement or just getting lost in the shuffle. It can support with multiple intercepts, right? As long as I've been involved, all of the pros to being out of custody are still there. And it's possibly a much easier coordination with law enforcement and judicial partners. So if there's probable cause and the law enforcement has taken me to this site and has deemed that they think that they could take me to an inpatient treatment unit instead of jail, if it's on site, that decision can be made up until the last point. So that's a big weight there. Cons may be that if I'm out of custody or maybe I'm not judicially involved yet, that it may access my ability or desire to want to go there. There's some stigma possibly around it that has come up around voluntary treatment, on the same site with the jail. And it's just less integration with other behavioral health services. So it would be farther away. There'd be more transportation from other centers to this one if I wanted to pursue that. If I go off-site, it would potentially be most likely co-located with our crisis centers. So with Dijwalich, with detox and crisis triage. And so one of the pros is if I go to crisis triage and then need treatment, if I'm co-located, it would be walking across the street or the alleyway and I could enter treatment that way. It means that, potentially more people will access it earlier on in the intercept model because it's not associated with the jail. So there's a little bit more deeper level involvement. And again, it can be used at multiple intercepts, just like the other one. The part where it kind of comes off the pros is if I was in jail and then needed and got this offer to have a prosecutorial diversion, I would need some really robust transportation in place to get from the jail to another location off-site, so that it's not necessarily a cab or I'm waiting on a caregiver, somebody to pick me up, but I'm hanging out. There would need to be a much more robust system to support somebody leaving jail and getting to that center so that we're not having a high risk of elopement, which is kind of a really big con of that process or that strategy. Again, requires really strong collaboration between the courts, prosecutors, and treatment providers because it won't be so much in your, in their awareness as it's in a different location. And there may be some resistance from law enforcement for using it as a deferral if there's probable cause. So just continuing on this theme, part of our justice implementation plan is the 23-hour center, and we've learned a lot. So we got a Commerce grant, it feels like a few years ago now, and before all of the statutes came out on what that means, we got the grant to build a 23-hour crisis center, which is very much in line with our justice implementation and helping people stay out of jail or the ERs if it's not medically or legally needed. So once we got all of the RCWs and licensing in place, we started to learn a lot. There's not a whole lot of centers doing this, but they are starting to get been running. And so we've been able to learn a lot from our partners around the state. The 23-hour center is a place where you can go for up to 23 hours and 59 minutes. That keeps it in an outpatient model. So you reduce a lot of barriers to entry because it's not inpatient. So it's meant to be accessible 24 hours a day. Law enforcement drop-offs are really heavily acknowledged in the statutes. It's no barriers. They need to be dropped off. They're typically dropped off within 6 to 7 minutes. And even if you're full, you have to take a law enforcement drop-off because that's kind of one of its main key principles. It's usually has like basic wound care, medical screening, nurses, peers are all involved, and a prescriber. As you can see in the image, there's often recliner based, so you can take a nap and go to sleep or like lay back. So when we look at where it falls on our intercept model, it's much more farther up in the early intervention side. The hard part is when we came to funding. So we've secured, $13 to $14 million in capital to build it. And that's just kind of under what we need. And we did a big pause. We had an architect design team on board and realized that we need more information about operations and how we're going to support it. So what we've learned is about Medicaid pays about roughly 40% of the budget, and which means 50 to 60% of the people utilizing these services are not Medicaid eligible or they're not on Medicaid. And so that could be Medicare, that could be catastrophic insurance, that could be non-insured. And what those costs are roughly $4 to $12 million annually that are left for the county or the local ASO partners to pick up. And so we don't have a funding model right now that can support that in a sustainable way. And so we are trying to look into that over the last few months, seeing how we can make this happen. There was a state law that came in, House Bill 1813, that described some legislative changes for payment, but it's really still quite unclear on how that will impact this project. And so that's supposed to start in January. There's a work group that convened. It includes the exec's office, City of Bellingham, Peace Health, the ASO. I feel like I'm missing somebody. Or if I missed somebody. There's a group of us that have been working on this. We convened 5 stakeholder groups this summer to gather input from community members and a variety of professions to learn more about what it is that we're actually hoping to get from the 23-hour, to see if there are other licenses or other ways of serving the same need. We have also started gathering data on what we think the estimated number of beds or recliners, so to speak, would be needed, to see if there's some efficiency in model capacity, like if it would be cheaper to go smaller. And so we are in the process of that, and we'll hopefully come out with some recommendations soon of what we're learning. So when we put this all together, what we're looking at is a behavioral health campus. So if the BCC goes offsite and we're able to do a 23-hour, We're looking at the concept of expanding that detox and crisis triage into something more, a place where you don't necessarily have to know where you're going or what license you fit into, but just a place for families to land and get help in redirecting or helping them navigate the system. What we're left with is really trying to figure out what are those last gaps, what are the prioritization, because we have many gaps. So how do we prioritize what we would say needs to happen first and in what order, what can be phased out? Like, so what can we say we need to happen, but we can't do that right now, but we need to make plans and space for them to be built or moved later. And so we're looking at a lot of that data and gathering as much information as possible. So when we put this all together on the map, you see the stuff in yellow would be kind of the campus model, and then the green again would be if we go in custody. So you see how we're trying to round out our model a little bit more. The blue is where we're at right now, and so we're trying to get more upfront as much as possible. And that's the end of my presentation. Are there any questions or thoughts?
Hannah, let's see, you don't have a slide for the legal model that was part of your part of the report, the model that you came up with?
I do not have that. I can pull it up. Do you want me to pull it up?
I think that would be good because that would kind of complete the whole story. And then I'd love to read the recommendation from the BCC work group and then go to questions so we can have a full discussion. While she's looking for this slide again, this is legal model was worked on by Judge Evan Jones, Eric Ritchie, Eric Sigmar, and Maya and Stark from the Public Defender's Office. And on the call today, in this meeting, we have our friends from around the county, in our small cities, the other courts and such. And so this is a important part of this whole story. So could you give us just a high level view of this, Hannah? And perhaps those that were involved in putting this legal model together could step in if there needs to be any clearer explanation.
Yeah, I see Eric Ritchie and Eric Sigmar on the call. I don't know if either one of them want to talk. They made this, in the legal team, they made this really beautiful image. But they kind of outline at places that they can meet and offer diversion. I'm gonna wait. Are either the Eric's gonna?
And I see Judge Jones is on the call as well.
Great.
So any of you like to present this at a high level?
This is Judge Jones. I'm happy to talk about this if no one else wants to.
Yes,
so
please.
we had the opportunity, Peter offered us the opportunity kind of as a smaller work group, those stakeholders that are involved actively with the court cases that find individuals in a circumstance where they might need treatment or engage in a behavioral care center. We were asked to kind of think about the court process and the opportunities where we could refer people into a behavioral care center out of the court process. So this graphic is meant to identify those opportunities we all thought could work and would work through agreement of the prosecutors and the defense attorneys or by order of the court. So you'll see there's a few different ones that start as early as booking. So at the initial booking of an individual into the Whatcom County Jail following a criminal arrest or criminal event, we've envisioned as early as that an opportunity where the defense attorney and the prosecutor can meet and discuss individuals on a regular basis up to daily following those bookings, that this person might be somebody that can be referred into an out of custody behavioral care center on day one, and would allow that to happen prior to any criminal charging. So in the criminal system, charges have to be filed within 72 hours of booking. So this would allow consideration of those folks within those 72 hours prior to a charge being filed, criminal charge being filed, and referred in that way. That's a more of a traditional diversion program. It's that it doesn't stop there though. If individuals either are identified later in the process after their booking, then there's other opportunities we all thought would be available as early as their first court appearances. So this would be could be after charging. The number 2 here, first appearance or arraignment. These are their first court appearances that usually follow charging, sometimes before charging. But again, it would be an opportunity where then an assigned defense attorney and a prosecutor, or just a unilateral request of the judge, could identify somebody that is amenable to the treatment, and then that person could then be released. We talked about something I heard Hannah say is that in an out of custody model, there's less external motivation from the court system for someone to complete treatment because they're not in custody. They could leave. So we kind of talked, and we talked in the smaller work group that the court could fashion release orders that would release somebody for the purpose of engaging in this treatment with conditions, court-ordered conditions to engage in the treatment, complete the treatment, be successful, with kind of with the motivation of returning to jail, I guess, if that is if they can't follow those conditions, if they can't comply with the treatment or don't decide they don't need to or don't want to. So we're giving them an opportunity, but under some pretty court-ordered conditions. So that could happen once the court process starts through a first appearance and arraignment, or extending into number 3 here, the pretrial process. The parties could negotiate plea bargains or ask the court for a release from traditional custody for the purpose of engaging in behavioral care center treatment. And then again, that would be an opportunity where a judge could agree and sign a conditional order of release for the purpose of engaging in that treatment. It would have a little accountability associated with that, basically through the court order. And then the final stop is if a case gets all the way through and the parties are able to plea, 95% of our cases plea bargain, and there's plea bargained resolutions offered in court. They involve sometimes a guilty plea. They involve sometimes a deferral of the charge or continuance of the charge while somebody completes positive pro-social requirements. And so that this number 4 here, the resolution phase, would be an opportunity for that, where plea bargains could be offered in court that would have the court ordering the compliance with treatment with some accountability associated with that. So it was a positive meeting, kind of in summary. It was a positive meeting between the real boots on the ground legal stakeholders here about use of a out of custody behavioral care center and how often we could find ways to on-ramp people into that program.
Great. Thank you so much, Judge Jones, for doing that. And Hannah, thank you again for your presentation. You must have done this 5 times already. And but it was so important to bring that to the IPRTF. And Raylene, before I get to you, I want you to hold your question, keep your hand up there. I'm going to read the recommendation from our group, which has, again, we have done our work, we have sunsetted the work group, and this is the recommendation we're bringing to the IPRTF. Once I read that, you've kind of got the full story, and we will get to questions. So it reads like this. The IPRTF BCC work group recommends adoption of the behavioral care center model as outlined in the draft document, developed as part of an integrated off-site behavioral health campus, providing inpatient, therapeutic, community-based care as an alternative to incarceration, rather than an in-custody model co-located with the new jail. The model incorporates 4 legal entry points agreed by courts, prosecutors, and defenders, a facility that allows for sufficient capacity to accommodate priority diversion referrals, eligibility for individuals charged with behavioral health driven offenses, and integration with crisis response and in-custody behavioral health supports. The work group further recommends that the IPRTF and the Finance and Facilities Advisory Board advance this model to the County Council for inclusion in Justice Project planning and cost analysis with data measures, models, and staffing roles refined as implementation planning proceeds. So that was our recommendation. And now we can have a good discussion around all these things that you heard. I think we can take another probably 17, 18 minutes. Raylene, go ahead.
Thank you. The first question would be for Judge Jones is, when you set pretrial conditions and people are released, and they're ordered to either return back to the jail or sometimes they're returned back to court. We have seen some gaps in the system already when we have temporary release orders for medical purposes. Sometimes people didn't get their fingerprints done because of it was a summons citation and it didn't happen when they should have. Is the intent that they go back to the jail and the jail monitors that? Are they able to do that? Or is the intent that these pretrial conditions would say you're going to report back to the court on this day and this time if you haven't done X, Y, and Z, then the hearing can be stricken or not stricken. So that's the first question.
It's a good question. I think the design is that it would be flexible in relation to people's circumstances. So, often orders of release, conditions of release are decided in court with a discussion individual to the person in court about the risk that might be posed to the community and the benefits of the treatment. So there wouldn't be some sort of template stamped order in relation to all these. They would be individual based on the needs of the person, the risks of the community, the perceived risks to the community. So it could include an order to return to the jail. I would imagine that most of these orders would include that if the person decides to leave treatment. So it would be, this is a bed available to you, a program available to you in kind of in lieu of incarceration. But if they don't engage in that, if they walk out the front door of the treatment center, then there would be an order to return to the jail for a consideration of release conditions. Again, at that point, I would think, but it would be flexible. It's also very meaningful, I think, that the Envision Behavioral Care Center is adjacent, although not within the walls of the jail. We're talking about adjacent to Sally, I think Peter said across the alley or across the street. So there would be a corridor back and forth. It would be easy to see one from the other and vice versa. So that's helpful too, I think. We might need to include some sort of release of medical information, HIPAA. These are details that would be discussed between the parties. But as far as having the behavioral care center inform the parties in the jail about the success of the treatment program and have the release that allows them to communicate in that way back to the court would be an important piece of this too, I would think.
Thank you. What other questions do we have or statements? Rosa.
Hi, I guess, I was a little late, but, so the 23-hour hold, so, I guess my question is like, can I get examples of like, who would be able to be dropped off? And then how often can someone be dropped off at that 23-hour service? Like can they go in there daily, or is it just a couple times a month? And my other question is, with the out of custody, the outpatient program, I'm thinking of my neighbor. So I was I have my neighbor, she did the health panel a few weeks ago. And I guess the big concern they had was that uh, their adult child refuses to take their meds, their psych meds. So if you're in, so say he or she got the, was part of this program, are they required to take meds or not? And then if not, say they're like, no, I'm not going to do it, then do they just go to the jail or what happens? Thank you.
Yeah, so for the 23-hour, it's a crisis center. So anybody who's having a crisis can go there, and you can leave. You have to leave. You can't stay for 24 hours. At that point, it's inpatient. And so, but if you leave for a few hours and need to come back, you technically can. I think the average seems to be about 6 hours. So the point is to stabilize and then get you somewhere else. So if you needed something longer, then we would hope that crisis triage is where you would go, because that's the actual intent of crisis triage. But yeah, technically you can stay for a few minutes to up to that. And then, yeah, you can return the next day if you're in crisis, and the team is there to help you stabilize and get to somewhere that you need more care, it sounds like, at that point. As far as med management, these, unless you're involuntarily held in a civil detainment, we cannot force medication. So regardless if it's in custody or out of custody, we cannot force those medications on anybody. That's still a choice. So, and that's something we see from people who come back from Western state who have required forced meds, and then they end up, and then they come back to the jail and it's voluntary. So it's just a really tricky place to be in the medical world. I don't know, Caleb, if you have 2 cents on that too, of like how that works for you.
All right, thank you, Hannah and Rosa. Prosecutor Ritchie.
Yes, thank you. I just wanted to say that I think this is our only real choice. Hannah laid out this the whole concept very well, including a cost-benefit analysis. And this proposal really answers the question of where can we divert people to? And frankly, that's what prosecutors, law enforcement, and the community has been asking for probably as long as I've been a prosecutor. So, this is a great opportunity for us to build that. I'm excited about it. I do want to say that this has been a difficult decision for us. We had a different vision in mind when we first started looking at it, but as we've studied it, this is the conclusion we've come to, and I think it's a very reasoned position for all of us. And with that said, I thank you all.
Oh, thank you so much, Prosecutor Ritchie. What other questions or statements do we have? Dan Hamill.
Yeah, I don't see anyone from the hospital on this call. Is there someone from Peace Health here? Apparently not. Okay. So my question would be, what is the benefit for Peace Health for One Central to not to have to work with these kind of clients? And then the other question would be, are we building a regional facility, or are we building a Whatcom County only facility?
Hannah and Laura, can you take those 2 questions?
Yeah, I can't speak for Peace Health specifically. I know around the 23-hour, we've captured some data of people who would be taken to the hospital that could be taken to the 23-hour instead. So there is some numbers, but as far as like how they feel about that, I think that we'd love to have representation at this group to speak to, how that feels on a daily basis. As far as regional, if you are out of custody, if you have a treatment facility, you cannot deny people. So if someone was in Skagit County, you can't say you cannot come here. So if you're going to accept Medicaid, and that would be a funding restriction that I don't think would be something we'd want to pursue. So it would have to be open, is my understanding.
Very good. And St. Paul, why don't you go next, and then we have Steve Harris.
Yeah, good morning, everybody. I just wanted to share a couple of things. One is that we should see what do we have now. We should see that what is really possible, because we do have expectations that why not have a regional facility? Why not divert people? All these things, like I said last time, that we at local level are very ambitious. We are very smart. We actually know what our community needs, and we can find those answers. But the thing comes in is how do we get resources to achieve what we really want to do? With limited resources, we have limited choices. So we have been deliberating on this process for several years. I'm just urging everybody to start narrow down and see what is feasible with what we have. And let's start, the time has come to start making some decisions. Deliberation, like I can tell you hands down, local communities know much better the solutions we can have and we should enact. And this conversation is not unique to Whatcom County, or we've been meeting for 2-3 years. You go in every county, 39 counties in Washington state or 50 states, everybody is having that similar conversation. And local level, we can visualize what would be the most efficient and best way to do this. So I would like to ask that let's look at what is available, what we can reasonably achieve, and what are the best decisions we can make with that. Because we are losing time, because the pressure is going to come from the construction and other decision making from the other teams. I mean, you know, I think we should have more discussion, but time has come that we have to start pinning down things. Thank you.
All right, thank you. And Steve, before I get to you, we have 7 more minutes for this discussion, and I've got a question for Kayla. Kayla, could you speak to where we need to go next after this discussion? How can this body be the most helpful in moving things forward in preparation for our design build team and the other processes? And then if you could answer that, and then Steve and Arlene, you've got a few minutes.
Yeah, thanks, Peter. So I know, so Hannah's given this similar presentation to the Finance and Facilities Advisory Board. The Behavioral Care Work Group's been convening tomorrow. Hannah will give this presentation to the Whatcom County Council, and we will hear this feedback. I think when the IPRTF is ready to make an official motion formally recommending this model or a version of it, we would transmit that to the county council, ultimately getting sort of whether it's a formal designation or a head nod from the county council that this is the direction we're heading. The executive and our team will relay that to the design builder, and we will start projecting this into sort of the programming exercise associated with the jail. Is that clear enough?
Right, that is clear. So if we are able to make that happen by our next meeting, late October, is that in alignment with the schedule?
Yes, I would say sort of in the interim, we are sort of laying the groundwork, proceeding with the expectation that this is where we are heading. So if people have strong objections, hearing that sooner rather than later would be helpful.
Great, excellent. Thank you so much for that. Steve, go ahead.
Hey, thank you. Great discussion this morning. I just wanted to point out that there is going to be a sub-segment of those who will require mental health services, behavioral care center services within the actual new facility that we're building. There's a lot of folks who won't be eligible for pre-prosecutory diversion or even post-conviction diversions, sentencing alternatives. So I just want everyone to keep in mind that when we are building the new jail facility, that there will be associated costs depending on how you want those facilities to actually look like. If you want to model something as has been thoroughly discussed today as part of an custody kind of behavioral care center for those who won't be eligible for any type of pre-diversion or release.
Thank you very much for making that point. Arlene, why don't you go ahead? We've just got a few minutes. You'll need to unmute yourself, though.
I want to remind everybody that we are the Incarceration Prevention Committee, and that is our purpose. And we've been working a very long time to come up with these various answers. And the 23-hour clinic is a way of preventing the problems that we are facing with the incarcerated people. So it's early intervention. The biggest problem is funding. And if any of you on this committee know people who are exceedingly good at acquiring funding, you hopefully will contact them immediately, because we need their ideas. Satpal is correct that there is a dearth of funding, and but we truly need it for this project to occur. And there are no barriers for people who are coming to this program. That is amazing, and it doesn't exist in our community of behavioral health. That doesn't happen.
Thank you so much, Arlene, for that. Okay, I'm going to wrap this this part of of our day up and move on to the next item, and we will be furiously working towards a process for October's meeting where we can make a good recommendation. I would ask that any of you, whatever your concerns are, whatever your thoughts are, reach out to me, reach out to Heather, to Jill, to state those so that we can make good use of them. And thank you so much. Okay, Birdie, let's move to your item. And since I presume we still have a quorum, and we'll take care of that and then move on with our agenda.
All right, thank you. Well, should be very brief. Just to refresh everybody's memory, at our last meeting, we passed the recommendation that supported the Village Reach proposal. And at the same time, the data work group had a recommendation that was discussed and placed on hold until this meeting. So in the interim, our data work group has met, and reflecting what we heard was one of the concerns, which was the original motion had recommendation about where this full-time data position should live. We have removed it, and so my proposed amendment is to remove the sentence that says, it's noted under removed portion here in this email, this position may best reside within the county executive's office. Strike that and begin the motion with, it is strongly recommended that the role be structured to operate with a high degree of autonomy, and then continue. So if I have a second, we can have a short discussion as needed.
I'll second that.
Great, we
Okay.
have a motion and we have a second. Let's have a discussion. Any discussion on the matter before we have a vote? All right, hearing none. All in favor of the motion, please raise your hand. I believe we now have to do this all virtually. So
Yeah,
please
Mr.
raise
Chair,
your-
To make sure there's an accurate record of the vote, I'd like to read out the names of those with hands raised. So
Okay.
I see Rebecca Mertzig, Heather Flaherty, Melora Christensen, Barry Buchanan, Rosa Hunter, Peter Frazier, Jason Cornelius, excuse me, Jason, if I'm mispronouncing that, Arlene Feld, Alexis Haas, Eric Ritchie, Deanne Hamill, Raylene King, Roger Funk, Jen Lockwood, Peter Frazier, Judge Jones, Jake Webush. If I missed anyone, please speak out.
Birdie, I see you raising your
Yes,
virtual
I'm
hand. Oh, there you
sorry,
go.
I clicked my button, but it didn't look like it raised, but I am voting in
Okay.
favor.
Great. All right, any opposed? Please raise your hand.
I see Eric Ritchie. Oh, maybe not.
There we go.
I don't see any
Okay.
hands raised in opposition.
Any abstentions? All right, the motion passes. Thank you very much for taking care of that quickly. Thank you, Birdie.
Okay.
All right, on to the next item. Now, Hannah Sloan, you're the next item up. However, I am a little concerned about our time. Could you and I have a conversation at this moment? How long do you think your presentation is going to take?
Probably max 5 minutes. If
Oh.
if we
Oh.
don't have lengthy discussion on it, it should go pretty quickly.
Okay, I think we could take 5 minutes for a discussion, so please go ahead. And I just want to say, Hannah, as chair or co-chair of the J-POP committee, has done just a fantastic job. I was so delighted by this panel discussion she is going to present to us. I learned a lot, and we've had really good discussion around it in J-POP. So please go ahead, Hannah.
Awesome. Let me see. Share my slides real quick. Okay. So just a recap of what the Justice Project Oversight and Planning Committee is charged with based on the IPRTF structure. So the J-POP committee, we serve as a forum for people with lived experience and frontline workers to be engaged and give feedback on key questions as the Justice Project implementation plan is implemented. We participate in the development of an evaluation plan to measure progress and results, monitor data to track progress on the implementation plan projects, prepare an annual report, provide recommendations for plan updates, and ensure public engagement and communications are robust to facilitate accountability in the plan's implementation. So as part of this mission, we wanted to implement some panel discussions to get more input on key questions from people with lived experience and members of the community on some of these hot topics. So our first panel was held at our August meeting. We had 6 individuals with histories of frequent incarceration and or family members of people who have been frequently incarcerated, and they very graciously discussed a few questions and discussed some gaps. So we asked them what gaps in the criminal legal system and social diversion services or ways the systems currently operate contribute to individuals being repeatedly incarcerated. And then we had a lively discussion about what their ideas for changes in the system could be to reduce reincarceration. Highlights, obviously, it was very powerful, very moving, their input. And it also was great to hear that the the gaps that they see kind of confirmed the research and the data that the Justice Project has incorporated into the needs assessment, and just kind of what we've already seen over the past several years doing this work. And then we also learned more details about how gaps related to timing and coordination were contributing to reincarceration. That was a major theme that kept coming up. And then next steps in September, this last week, we had our September J-POP committee, and we reflected on that panel discussion and then further explored how gaps related to timing and coordination in our system could be addressed, and what further panel discussions we want to incorporate into our meetings. And we asked that the steering committee provide some recommendations, and then IPRTF members, if you have any recommendations for groups of people that you would like to invite and key questions to address in these panel discussions, we would love that that input. And then I'll just do a brief recap of what the major themes were in their feedback. So like I mentioned, timing and coordination gaps were major factors. Housing, particularly for individuals with serious mental illness and substance use disorders, is very clearly lacking in Whatcom County. And I think we all know that, but that was something that they really wanted to highlight. And one panelist stated that many people cycle through jail while waiting for housing or treatment. One person had experience with getting into detox and missing an appointment window because there's only a 15-minute waiting period for them to come and do the intake and get into treatment. So that causes missed treatment opportunities. And then when people are unable to get into longer term treatment facility through detox, those beds can often fall through because there's just a lack throughout the entire state of treatment beds. And so it's like, well, why would I put off going back onto the street for a couple of days when I can just, go and not have as bad of a potential, not have to deal with the withdrawal symptoms for a couple more days if the result was that he was going to go back to the community anyway because there was no treatment bed. Let's see, delays in court cases create additional barriers. One participant mentioned that he has been waiting since 2022 to resolve his case, and if the sentencing ended up with him going back to jail, that would really hinder his recovery. He's a few years clean, and going back into that environment would be pretty detrimental for somebody on their recovery journey. Let's see, lack of legal representation was huge, and that's something that was discussed in our September J-POP committee upon reflection. Limited jail programming and poorly timed releases also contribute to reincarceration. Panelists said that they wanted more funding for recovery court and mental health court opportunities, additional counseling in jail, AA and NA meetings while in jail. Some mentorship programs were mentioned, and just expanded resources in general. So it's kind of an overview of what we've discussed and what we hope to continue to discuss in future meetings.
Fantastic, Hannah. Thank you so much. I'd like to do two things. I'd like to recommend to you that we, J-POP, could do well to have a similar panel discussion using frontline workers. I have learned so much from caseworkers who work throughout our county, throughout our system. They offer a perspective that I think that all the people on this call could do well to hear. So that's my recommendation there. And let's take we have time for just a few questions, make 5 minutes or so. So thoughts, questions, Birdie?
Yes. my question, you asked for feedback on future panels, and I wholeheartedly agree with the first suggestion from Peter. What I was wondering, we know that the majority of people in jail have substance abuse and/or mental health issues, and that's what was clearly reflected. Do you think there would be a value of hearing a panel of people with repeat incarceration who are not suffering from mental health or substance abuse issues? And would we learn a different perspective? Is my thought.
Yeah, and I think at the steering committee, I believe Holly or Marty had mentioned that we kind of put this request out to whoever, and it just so happened that the people that participated in the panel have the substance use background, and I think that's what we're going to see for a majority of the people. 75–80% have at least one either substance use disorder or mental health disorder, and many of them have co-occurring disorders. But I think it would be valuable to see if there are people out there willing to discuss what gaps they see, because we want to be able to serve as many people as possible and increase resources for everyone. And we only have resources right now to prioritize the most vulnerable and the people with multiple co-occurring disorders. So the people who don't have that diagnosis are often left behind. And we want to, as a whole, kind of reduce incarceration, prevent incarceration. So I think it'd be very valuable if we're able to. So if anybody knows anybody or anybody that we could get in contact to get to those people, please forward that information to myself, Holly, Marty, or Tasha.
Thank you so much. I just want to point out to everybody that if you can just take the time to go to the August meeting of JPOP and watch the panel discussion, I think there's a lot of good firsthand experience, heartbreaking experience expressed there that would inform all of our work. All right. I think we better bring this to a close. Hannah, thanks for taking the time to present to the IPRTF.
Thank you.
Okay, the next item is the review of the IPRTF calendar, priorities and goals and action plan updates. Really, this is the time we have, if you have looked at the action plan, the 2025 action plan, this is the place where we have our committees have put their thoughts, intentions for 2025, moving into 2026. Heather and I took everybody in the IPRTF and the committees through a process to really help us focus our work in our committees on actionable items and issues that we could help this county move forward with. And we chose 3 top goals of all the other things that we're up to. And those were best practices for design and operations of the new jail and BCC. 2, development of performance measurement plan and data dashboard to track progress on implementation plan projects. You've heard from Bertie today. Her committee and work group are doing really good work there. Village Reach provided us a report, and we have a framework for moving forward. 3, strengthen and evaluate diversion programs to improve outcomes, reduce recidivism, and provide alternatives to incarceration. And our Behavioral Health and Legal Justice Committee have been at work on these. I would like to propose, and Heather, if you could step in here with any thoughts you have on how we might be able to spend the next say 25 minutes to help us to advance our conversation among our committees. What have we accomplished in this last year, and getting ready for a discussion in October where we're going next. So that's basically the idea behind the action plan. I highly recommend you reviewing the action plan. There's a link to it in your agenda, and it's good, useful intention. And Heather, do you have any thoughts for us? How to move this conversation forward? What would you like to see?
So the goal is to set us up for a great discussion in October about the calendar for 2026 and where we want to focus. And what I heard you ask, and I just want to clarify, for those top 3 goals, it would be great, I think, to hear from everyone here what the accomplishments are that you've seen and where we still need to go on those top 3 goals. I'm scanning down to the top 10 goals list also. It'd be nice for us to just check real quick on what were the next 7 goals we all said were also very important. And are these the right things to be focused on? And would you give us an A grade so far or a C grade? What's missing? I think those would be key questions to really generate some conversation right now.
And this is not a conversation just for the committee chairs, but as IPRTF members and observers and participants, I think it's a good time to hear from everyone. So please. Anyone with a comment or thoughts around this last year, accomplishments, failures, intentions for next year?
No wrong answers, and I might ask some specific questions too, Peter. I'm curious for Kayla and executives to do for these 3 goals from your side, from administration. What has been helpful from the IPRTF so far this year?
Yeah, Heather, or Sept, do you want to take a stab at it, or would you like me to answer first?
I said, go ahead, Kayla.
Okay, great. I would say the way the behavioral care work group has transpired has been extremely helpful. And I also appreciate how well it's like sort of synced up with our timelines on the project. So the role of the IPRTF as a convener has really been helpful and saved a lot of staff time, as well as the work Peter's done to sort of continuously keep us updated so we're not getting out of sync with timelines. On the data stuff, I think it is helpful to see right now we have a specific recommendation coming out of that work. It's a tangible like digestion next step for us to chew on. I think what would be even more helpful is, right, like the Village Reach report is a huge swath of recommendations, and the data work group has developed sort of some action steps for us, but I think we may benefit from sort of some more policy analysis, policy summary type written documents on some of that stuff, because it's a lot for us to digest. It's going to be a lot for the county council to digest, and it's a lot for the public to digest. So in terms of things that would sort of build and continue to be more helpful, it's like, how do we sort of distill all of the work and thought into a 3-page policy memo about like, what is this? What impact is it going to have? And then tie that with these next steps for moving it forward. Because absent that, that framing, right, it's like, leaves the public with the question of like, to what end, right? Mm-hmm. So that would be my recommendation.
That's a great recommendation. Thank you. Can you share a little more too? You said to make sure to answer the questions in a policy memo. What is this? What impact will this have? What other questions would be good in a framework like that for you?
I mean, we always have the questions of sort of like, what is the cost, all of those kinds of things, but that's stuff that we can collaborate on and provide sort of the administrative side of a recommendation. The feasibility piece, I think, is helpful. Like, you all have been doing so much work on this data stuff. The analysis of like, sort of, is this a practical implementation for where our system is at and what constraints we have, and making the case. I mean, obviously you all feel it is practical or you wouldn't be recommending that, but making that case in a succinct way, along with the why and the what, I think. And then like, right, like in the first year, we expect this person would do X, Y, and Z. As work continues and our technology improves, work could expand in these areas, like a little more of a, so it's not like this fear that we're going to hire someone and then what are they going to be doing? We're sort of, what is the work plan and why is it important?
Okay. Thank you, Kayla.
Yeah, for sure.
That's great. That's really helpful. And Bertie, I'm sure you're taking notes. Dan Hamill, please go ahead.
Thanks. Sorry, I'm trying to wolf down some late breakfast here before I go out with the DWAL Each people and do some outreach for folks. So pardon my chewing. So I think one piece that I observed over the last, I don't know, probably 6 months or 9 months was that different groups were assigned to the same task. And by that, I mean, there's a BCC work group. And then as chair of the Behavioral Health Committee, we were tasked with coming up with work groups for data, for reentry, and for the Division Street property. And so what happened is that our Division Street folks, that work group was doing parallel work, in essence, with the BCC folks. And so we had two groups of people that were doing kind of the same thing. And it just was completely inefficient in my opinion. And so my recommendation was pick one group and have them do it, and then bring the recommendation to the authority group, and then we can just put it up the chain from there. So that would be one observation. And then kind of turning it on its head, looking forward, I would like to we've got one rep from the mayor's office here on the call. Jason is here. I would like to get some kind of I don't know, just kind of direction on where we're going, where the city's going to be going when it comes to behavioral health dollars, and when that corner is going to be turned from moving away from more of a, purely capital investment and more into just kind of funding the operations for ongoing. So those are my two thoughts this morning.
That's very helpful,
Dan.
Dan. Thank you. How about others? Raylene, you're a co-chair of the Legal and Justice Committee. I'm wondering what thoughts you have about accomplishments. I saw, I know you're going to be reporting on your last meeting. You're having some conversations in that group that are absolutely critical to the functions of the legal system. And as we heard in our last presentation from Hannah, some of the biggest problems are in people, the slow nature of the legal system, and assignments of attorneys for the folks in jail. I know that you are talking, there are bail reform, there are conversations about bail, there's conversations about court at the new jail. I'm just interested in anything that you guys have been discussing that you feel like you've accomplished, conversations that need to continue into the future, that are going to solve some of the critical issues that the IPRTF is responsible for.
Thank you, Peter. So we did have a meeting a couple months back in which Commissioner Casey Emmerich was there and Judge Jones, and it's expanded on 3.2 conditions, release conditions, how bail is set, the requirements, the constitutional requirements. Whereas a lot of times there's some members in the community that think we should get rid of bail altogether. There's other members that think that it should be stronger. So it just kind of depends on what side of the fence you hear from. With that being said, the judges have very strict requirements that they have to follow. And so our county representatives explained those, and then we will most likely have another speaker from the fire brigade, which is a group of judges throughout the state that get together and answer public questions. I did get a response from Judge Johnson from Walla Walla, who said that he'd be willing to speak at the November 24 task force on those conditions. So you're not just hearing it from our county, but you're hearing it from the state officials on what the requirements are. So when people say that we should have these reforms, they understand the constitutional requirements and how those release conditions impact whether somebody has high bail, low bail, and how those things are set up. So I did get a response back from him this week moving forward, but we also did already hear on our end. Some of the other discussions that we have had is that, I know sometimes they say, well, the judges shouldn't do this and the judges shouldn't do that, but there's also a lot more in play because when a defendant gets a new defense attorney, that defense attorney wants to do the best job for his client and starts over with that case. And same if there's a new prosecutor. If a prosecutor leaves the office and they get a new prosecutor, that prosecutor wants to put on their best case. So both sides have something in the game to make sure that they're doing the best job, but that also delays those court processes because there might be more investigation. And as most of us know, time is of the essence on these cases, but sometimes we're setting things back because we've got new attorneys, new witnesses. There's also stuff that we've talked about before. And I think we're doing better on restoration and competency, but there's still delays across the state when somebody goes away for restoration and then they come back and we think we're good to go, but they start the case all over and then there's more delays. So there's kind of a revolving process in those areas that have been discussed. And what we can do better. We've also talked about some of the diversion programs, and although we are doing great with LEAD and there's mental health court, there was a recent presentation of the family court with Bellingham at our last meeting, which was very insightful. Those things are moving forward, but there's still the struggles with reentry, the current space that we have in the jail. There's concerns about Medicaid. So you see a lot of the cross between the Behavioral Health Committee and the Legal and Justice Committee, as well as when there's not funding for housing for some of these people, that is also a setback for some of the diversion programs. And funding is always a key to a lot of that. So those are some of the things we've been working on. I can tell you that we've been working with the jail and other stakeholders throughout the county to try to streamline processes to make sure that we're using the time that we have in the jail courtroom best for all of the stakeholders, because it's not just Superior Court, but it's district court and the municipal courts. And whenever you're shifting who's doing what, that's one of the issues. We've talked about some of the interpreter delays. I think we've worked really hard on streamlining those processes, but there's still struggles with that. So over the year, there's been a lot of different areas. But like I said, there's a lot of interlap. We are working also, I think that data piece is critical for all of our different subgroups. And we hope that within the next year that we'll have more information, and because we do have more staff working on it. But we need additional assistance in that area. So those are my thoughts. Any questions, comments, or did I miss anything, Peter?
Oh, that's fantastic, Raylene. I found that really informative. So thank you. And Dan, I see your hand up.
I'll be quick. I know we're kind of pressed for time here. I just wanted to.
Well, we're good. We're good. You go.
Okay. Okay, so I wanted to add to something that keeps coming up that Raylene mentioned, and that is the housing component. And I know that's not our charge, but I always find it kind of fascinating that when something on the that appears to be like tangential goes to the middle, and it keeps going right to the middle all the time. And so that housing stability for people wherever they're at in the sim, it just keeps coming up. So I don't know quite the role for this group. I know that the city has done a few things, and the county's done some other things that are pretty similar when it comes to addressing housing that affect the folks that both victims and perpetrators that are in these scenarios that we're talking about here. But I do think that we just need to reconsider um, um, how housing plays a definitive role in the work that we do. And I know that people think about it, and I get that. And but I just want to make sure that is like centered more properly in these discussions. That's it. So
No, that's a great point. Barry, go ahead.
Yeah, two things real quick. One, I totally agree with Dan on the housing component. We saw that when we went down and saw Link, and they didn't have much housing, but there was a few units that were connected to that program that made it work because people were able to have a way to move through the system. They had, places to go. The second thing I wanted to bring up is, we talk about giving the task force a letter grade. I would give it a B because I knock off one letter grade on every effort the county does because of communication. So what I think, what I've got frustrated with this year was I had a meeting with district court to follow up on a letter that the task force received, and they were unaware of the ordinance, they're unaware of the implementation plan, the folks I talked to. So it was very frustrating to see that the word just isn't getting around, not only out to the public, but internally to our own partners in this work. So I want us to be able to double down on our communication so we can make sure that this good work is conveyed across all participants throughout the county plus the public. So that's my little 2 cents.
Fantastic, Barry. And let's have some discussion, maybe in the October meeting or now, around how we can better communicate. I think we've spent a lot of time talking about how we better communicate to the public, but perhaps not as much about throughout the county. So, who else has some thoughts? Eric. Richie, please go ahead.
Yeah, I'll say a couple things. I think we're really talking about reflections right now.
Yeah.
Get my video on. There we go. Yeah, we're talking about reflections, and we have a real project in front of us, but it feels like we're working on some real tangible things, and that's been feeling pretty good. We're talking about things that are bringing a lot of engagement to a lot of stakeholders, and we're getting a lot done. And it also feels like this group is more collaborative than it's been in the past. So I can't say anything but positive things about the IPRTF right now.
Oh, that's nice to hear, Eric. Thank you. Others? I think we just have a good time here to maybe another 5 minutes before we have committee reports on reflections. It's a great time for any thoughts you have, and I sure appreciate all the participation we have of the members on screen. We have 36 people participating right now. That's pretty fantastic. And Jill, I see that there's a hand up in attendees. I'm not sure how we get that person on board, but Holly, go ahead.
I believe this is Riley. Riley, go ahead and speak to the task force.
Okay. Yeah,
Hello, hello.
Riley.
Can you hear me?
Yes, we can.
I just wanted to, while we're reflecting, share the same update that I shared at J-Pop about our first blast of communications around the Justice Project, since I know you're all deeply caring and involved. We did the first update of our Justice Project newsletter, which went out to over 700 people. Over 60% of those people opened the email, which, if you know anything about email marketing, is amazing. We've also had over 17 new signups for our monthly email blast, and it's getting great traction on social media. So I was really happy to, one, finally launch our communications efforts, and two, that they've been well received.
Fantastic, Riley. Thank you very much for that update. Holly, go ahead.
Hi, yeah. Well, first, I just want to echo what Eric was saying. I think the progress is so inspiring. And Peter, I just want to give a shout out for you for your excellent leadership here. And, you know, Barry with the steering committee and Heather right there and all of you. I mean, it's really so inspiring. And I wanted to make a process point because that's my job. So
That's your job. Yes, please
I
do.
share screen for a minute. I want to just make a comment. So can you guys see the action plan diagram here?
Yes, we can.
Okay. So I'm thinking of this like this year was our first year of really dialing in how our process works to update these plans, right? And what I would like to suggest is that it would be super helpful if all the committees could actually look at their work plans that are in the action plan and even do a track change. Like, what do you still want to continue? What do you want to let go of? And if you can even highlight things that are key accomplishments that you want to put into the annual report, that would save time. If we can have everybody put these into the packet for the October meeting, that would save time. Because I know Heather and Peter had to do a lot of kind of chasing after trying to help everybody. And if we could just avoid that, if we could just create some efficiencies, I know we'd all be excited about that. And then one more point, which is I am really loving how Heather teed us up to also think about the big goals. And the comments that were made by Barry and by Dan about like housing being an issue we want to maybe prioritize in communications. So I think also in addition to updating your individual work plans, if folks can also just give some more thought to those bigger priorities in October, and we continue and have an equally robust discussion in October. So I
That's
feel
fantastic,
we're
Holly.
starting to really dial this in, and it's just going to build our momentum. So
Absolutely. I was this weekend, I was reviewing the entire packet. I came across this and was very thankful that you and Marty had put this together, and we have established kind of a seasonal cycle, which is really starting to take effect. I would love to say to all our co-chairs of our committees, please do review the action plan as Holly has talked about. There's good stuff in there. And you and we came up with this together, and it requires review in the next few weeks. So please go through it and make good use of it, and let's advance the mission. Heather, is there anything that you'd like to say or before we move on to committee reports?
Yeah, just for the record, I want to mention a few things. We don't have to discuss them right now, but as part of this conversation, I'm hearing communications and that there's opportunity around that as an overall goal. And some immediate thoughts are just everybody has a million emails, and what's the kind of too long, don't read 3-bullet update that could be an internal email after these meetings to whatever listserv makes sense, right? That like if the district court, I mean, court reform is on here as our 5th goal. And it's important to have those internal partners know what is the consequence of the conversation at the IPRTF and the committees and the policy shifts and the community engagement and opinions and decisions that we make here. They are consequential and internal leaders should know about it. So what's the method and format that makes that easy? And I also want to remind us that there is an RCW around the Law and Justice Council that we're also fulfilling, and it might be nice in this planning process to review that RCW and ensure we have the right people at the table to achieve the outcomes in that RCW. One issue that I continue to hear about that I am so craving real data around is the 90% pretrial numbers in our jail. And when we started these conversations in 2015 as IPRTF, the pretrial number then was around 60%. And even that at that time, we all thought was way too high. And so as that relates to all of the goals, I'm hopeful that that can be a conversation here and at the committees. One thing I heard though too from Dan, I just want to state and let you know I hear it, is the clarity of assignment of who is owning what goal, where are those conversations living, and is there a reason for a separate committee to do a deeper dive on something like the behavioral care center, and how does that intersect with the behavioral health committee as an example? So I think we can do a better job self-organizing and even looking at these top 10 goals, what committee is addressing it and what are the, like every meeting, what was the conversation or the movement that we made or didn't make on these goals together. So thanks for a great discussion. I see Wendy's hand came up too. Wendy, we'd love to hear your thoughts.
Just a little informational more than anything else. Mentioning the 90% pretrial. I know where that's coming from, and a big part of it is delays through the courts. And so what happens is when somebody finally gets their case adjudicated, they've already served their jail time. And it's not unusual that they wind up spending longer in jail than they would have had the case been able to get settled earlier. So and then if you look, you'll find that that proportion is very significantly felony offenses. And that deals with the jail's got to prioritize who stays in custody and works with the system in order to try and get them moved. But the biggest thing, if you look, the dispositions on a lot of the felony offenders are credit for time served released. So if we could get that done sometimes years earlier, but usually those are the really complex cases, and that's a relatively small number, but that's a big reason for that.
I mean, that's Wendy, I so am grateful for your knowledge and insight on that. And I think I personally, Peter, think it could warrant a subcommittee similar to the BCC to just really dive into who is pretrial, why, and what are the court pieces, the public defender and prosecutor pieces, the different diversions needed. And I mean, it's just what you're saying, Wendy, is I don't find it acceptable that people are in jail sometimes even longer than what their sentence would have been. And I think it's clearly a really complex issue. So, and I love that it's getting some hands raised. Eric, what do you think?
Yeah. Well, I have a question for Wendy, and maybe she knows this, but it seems like we don't sentence people to jail like we used to. People are being sentenced to alternatives, so that might change the stats. Frankly, at this point, we're holding people who are flight risks and who are dangerous, and I think that's generally all that we're holding right now. So of course that's going to skew things to the stats that we have today. At least that's what I think. Wendy, maybe you can correct me if I'm wrong. But I also want to throw something else out. We have recently been able to pull some stats that show that my office is resolving more cases than we charge. Yeah, some more cases are getting done than are getting charged at this time. And I thought y'all should know that.
That is great to know.
Thank you. Heather, we should probably, let's see. I guess we should move on. Oh, what a great conversation. And actually, our next conversation is very, very related. It'll just be an echo, and that is committee reports, and then we'll have public comment, and then we will close out the meeting. Let's just go down through the list. Highlights from your last meeting, and this is for co-chairs. So let's start with legal and justice. Raylene, do you have some, I know you just gave us some highlights over the year. Do you have some things that you have been working with in your last meeting or two?
So, yeah, in our August meeting, we did talk about the design in the new jails and what we feel should be pertinent for the court's needs as we look at the new facility, and to make sure that we're not having to worry about transporting people back and forth, that we have enough courtroom space, because we currently are struggling with the courtroom space at the current facility. So as we build and project out what we think would be beneficial, to make sure that those that are incarcerated are being processed in a timely manner with the ability to have enough courtroom space there. So we were looking at future planning and logistics and IT needs were some of the discussions with that. We also did discuss driving while license suspended in the 3rd degree, statistics on that data, as well as warrant data. And then action plans. And then our September meeting that we recently had was between behavioral health and the joint legal and justice. And so I'm going to turn that over to Dan and his team to discuss their meetings, because I think there's so much crossover, it would be beneficial to hear from them, unless there's questions on legal and justice.
Any questions on legal and justice, or shall we hear from Dan? Dan, go ahead.
All right. Thank you. Thanks, Raylene. I was kind of hoping that you'd cover it, but that's fine. I'll do it. So just for quick background, so legal and justice and behavioral health has so much crossover that we meet, Raylene, what is it, like 4 times a year now? Pretty much every quarter. And it makes sense. I mean, there's a lot of overlap there. So we had, I'll just kind of buzz through the topics here and we can take questions if there are any. We had Chief Erickson from the Sheriff's Office, and Chief, you had a lieutenant there, and I wrote the name down, but I'm not looking at it right now. Can you start with a K, I think?
I don't remember. I have a couple of lieutenants. I don't remember which one was there.
Lieutenant Jason Carb.
Oh,
Carb,
I'm
yep.
sorry. Yes, it was Jason Carb. Yes.
Yeah, he gave the presentation, and it was on peer support team, deputy wellness, essentially, which is, I think, very important to this group. And then we also had work center. Hold on one second. A work center reentry demonstration initiative program was also presented by Chief Erickson, Caleb. We had a Division Street work group draft of recommendations that was presented by Hannah Fisk. I don't think, maybe she's not on the call anymore. But basically this is kind of what I was going back to in my earlier comments, is that, you know, let's not overlap the groups, and let's have one group do the work. And anyway, so we made recommendations on what we want to see for our for the Division 3 property. That is the one that's located at 2030 Division, that has Ann Deacon Center and the work facility as well. We also had a presentation by Andrew Mitchell from Bellingham Community Court, which is a newer program that Bellingham has initiated. It was in response to the recriminalization of public use, which makes that crime a misdemeanor, and then the state quickly followed maybe 2 weeks after to make possession a gross misdemeanor. So in response, we wanted to make sure that there were proper off ramps for folks to give people a choice. And then the community court was came out of that discussion. So anyway, that's kind of the joint meeting. I don't know if there's any questions from the group here today.
That's great. You covered a lot of territory.
All right.
Any questions for Dan? Okay, seeing none. Hannah, you actually gave us a presentation about what your last meeting was about, but I believe you might have covered a few other things. Is there anything that you would like to bring up about J-POP?
I think the biggest update is, yeah, we had our lively panel discussion, and then Riley presented on the communications plan for the county and the Justice Project. And then we also had, where did it go? An update about the measurement-based, where is it?
Was it the Village Reach report?
Yes, I think, and just the implementation of the performance measurement plan. Yeah,
Yeah.
that was all in our August meeting.
Fantastic, thank you.
We had Adam
And
from STV come too, which was great.
yes.
Thank you.
Good. Okay, Barry, do you want to give us a report from steering, and then we'll have public comment, and then we'll all go back to work.
Oh, thanks for that lovely thought, Peter. Anyway, we had our steering committee meeting, and our first item we had was this wonderful report that Hannah Sloan gave from J-POP, and I just was so impressed with how we're diving in to find lived experience and really walking that talk, and that's what we need to continue to do. So we also talked about the legislative agenda for next session. There hasn't been much conversation around that because there's a lot going on right now with the administration preparing the mid-biennium budget and just a lot of things going on. But we decided that we would form another work group, which would be a kind of a legislative strategic agenda work group that will work with the executive's office, and it's kind of under development right now. Brian Estes said he would go off and write a kind of a description of what that work group might look like. And I know he's drafted that. And I think steering committee members, you'll be seeing that hit your inbox if it hasn't already. I think we will be bringing that back around. We would love to have people, if you're interested in being on that work group. Right now, it's myself, Peter, and Brian Estes, but we would love to have some more. We can't exceed 4 people on the steering committee. That's our kind of quorum limitation. And of course, we can't exceed a quorum of the task force either. So anyway, that's on the legislative agenda. Then we talked about the 2026 potential calendar and the kind of the idea we've been talking about with our committees versus work group structure. And I think the tentative plan that we've landed on is that the work groups are great, but they're not going to replace the committees. The committees still need to be having public meetings that have public comment opportunities. We don't want to lose that transparency. That's what the steering committee is really leaning towards. We're going to take this plan and the schedule that Jill has developed that would take our committee meetings potentially to once every 2 months, with the option to expand the time that meeting might be, an hour or an hour and a half. It would be up to them. That committee can decide that. But the committee should see that in their October meetings as you meet next month, and then we would bring this back around to the task force in the November meeting. We would love to have something figured out before the end of the year so we could implement it rolling out into 2026. Anyway, that's the big high points of steering. And if there's any questions, that's great. Otherwise, I'll throw it back to Peter.
All right, thank you, Barry. That's wonderful. Just a note that Brian and I have been collaborating on that legislative work group kind of mission, and we will soon bring that forward. Okay, time for public comment. There is nobody in the conference room with me. How about attendees or anybody online who would like to give us 3 minutes, up to 3 minutes? of public comment.
Any of our attendees would like to speak to the task force, please virtually raise your hands now. And just right quick, I would ask the planning team members to stay behind for just a quick check-in. Attendees, if you'd like to speak to the task force, please raise your hand. No hands are raised.
Okay, all right, well, we're gonna close out this meeting and then planning team members, if you could stay behind just briefly. Thank you so much for your participation. I think it was a good meeting. I got a lot from it anyway. And we will see you next month, and thank you very much.